Hypoparathyroidism. Hypoparathyroidism is a condition in which the parathyroid hormone, PTH, has insufficient action on tissues to regulate and control mineral storage in the body, such as calcium, phosphorus, and magnesium. Pseudohypoparathyroidism. The hormone is made normally in the parathyroid glands, and its quantity in the blood may be high, but it is not recognized due to a deficiency in the target organs, resulting in a set of illnesses known as pseudohypoparathyroidism. Pseudohypoparathyroidism, type A1, is defined as hormonal problems with the parathyroid gland, additional hormonal systems, simple mental retardation is present, short stature, obesity, and a short fourth ossa metacarpalia in the palm of the hand are all common characteristics. Hypoparathyroidism symptoms. Hypoparathyroidism, in its different forms, can manifest as typical signs of a low calcium level in the blood, hypocalcemia. The following are the signs and symptoms. 1. Symptoms of calcium insufficiency in general. The following are some of the most common symptoms of calcium insufficiency in patients. An ant sensation along the extremities. Muscle contractions that are not voluntary, particularly in the palms of the hands and feet. Tetany. Epileptic seizures. Hypocalcemia, on the other hand, may not manifest any symptoms. 2. Chronic calcium insufficiency symptoms. Chronic hypocalcemia is linked to the following factors. Cataracts that appear early. Calcium deposits in the brain's basal ganglia. Problems with tooth development in children. Hypoparathyroidism causes and risk factors. Hypoparathyroidism can be caused by a number of factors, the most prevalent of which are: injuries to the parathyroid glands can occur during neck surgery. DiGeorge syndrome is a rare congenital disorder in the development of the parathyroid glands, usually associated with a cellular immune system deficiency. Physical damage to the glands, as well as damage caused by an autoimmune reaction that affects the structure of the glands. Hypoparathyroidism that develops later in life and is not caused by another condition. Disturbance in parathyroid hormone production. Hazard factors. The following are the most important factors that raise the risk of having hypoparathyroidism. 1. The genetic component. Autoimmune hypoparathyroidism is a congenital familial disease that has a proclivity for causing immune system harm through many hormonal and non-hormonal systems. Hereditary hypoparathyroidism has recently been characterized as a result of excessive activity of the sensor that determines the degree of calcium concentration in the gland's extracellular media. This type of hypoparathyroidism is discovered by chance, has no side effects, and is characterized by a large amount of calcium output in the urine, especially when trying to balance calcium levels in the blood. 2. Exposure to radiation. Radioactive injury to the neck can cause hypoparathyroidism, and radioactive iodine therapy to the thyroid gland can cause it in rare cases. 3. Other ailments. Some of the disorders that cause the sickness include metastases of cancer. Hemochromatosis is a condition that affects people. Amyloidosis is a kind of amyloidosis. Hypoparathyroidism complications. Hypoparathyroidism can lead to a variety of issues. 1. Complications that can be repaired. The following are some of the most important. Hand cramps are a common symptom. A burning sensation in the lips, mouth, or fingers. Seizures epilepticus. Misshapen teeth. Issues with renal function. Abnormalities in the heartbeat. 2. Long-term complications. The following are some of the most notable. Dwarfism is a belief held by dwarfs. Retardation. Epilepsy is caused by calcium deposits in the brain. Cataract problems. Hypoparathyroidism diagnosis. Hypoparathyroidism is diagnosed by a blood test, which reveals the following symptoms. Calcium levels in the blood are low. Phosphorus levels in the blood are unusually high. The concentration of parathyroid hormone varies depending on the reason of hypoparathyroidism. In most situations, it is low or less than expected, and in rare cases, it is healthy or high. Treatment for hypoparathyroidism. The following is the cornerstone of hypoparathyroidism treatment. Calcium supplement. An efficient vitamin D supplement that aids calcium absorption in the intestines. Because parathyroid hormone has no effect on the kidneys, this medication may produce hypercalcemia in the urine, which can lead to the production of stones in the urinary system. As a result, an attempt is made to get the calcium concentration down to the bare minimum, and a thiazide diuretic medication is added to increase the rate at which calcium is absorbed from the urine into the bloodstream and to avoid an excess of calcium in the urine. Thiazide therapy should be used with caution, especially in those who have calcium receptor hyperactivity. Synthetic parathyroid hormone. In recent years, the hormone has been successfully trialed as a therapy for osteoporosis in both women and men using genetically modified approaches. Its effectiveness on patients with hypoparathyroidism was tested in a few cases, and it was proven to be effective. However, there are some restrictions in terms of safety. Treatment with it as a long-term hormonal substitute is currently forbidden. However, it is not ruled out that treatment with it will become the standard of care for hypoparathyroidism in the future. Hypoparathyroidism prevention. Although there are no strategies to avoid infection, it is recommended that you tell your doctor if you are in the risk group or have calcium insufficiency symptoms.